So, what do you do when there's pain with no direct cause or no apparent cause that you can point to? And somebody says, like I threw out my back while gardening or lifting weights. That's obvious, but how do you approach those situations where there's no apparent cause?
Most of our patients come in with some sort of acute injury. Oftentimes it's lower back because the lower back tends to be the one it gives the most easily. It bears more than half of our body weight. So ultimately there's lots of pressure on it. But most of the time, whenever patients come in, it isn't some drastic episode that, I swung a golf club and blew out my back, or I lifted up a bag when I was gardening and I blew out my back. It's usually something as simple as I bent over to wash my toes, or I, was bending over to brush my teeth in the morning. So it's usually the straw that breaks the camel's back. And what that tells me is this has been a lingering issue for a long time. And so it's just that, pain threshold, it's an alarm system, like I said. And so you'll live under that threshold for quite a while. And then ultimately there's just a small little subtle variable that changes. And now you're above that pain signal. But it means that thing has been accumulating for quite a while. And I tell people this all the time, and it's a tough analogy, but people understand it because we've all unfortunately known someone. But oftentimes you have very healthy people that drop dead of a heart attack. And it's, that person didn't get 100% blockage of that artery that day. That's been accumulating. And it's the same thing with that lower back. And that's why as chiropractors, we're so into preventative maintenance is you give me the opportunity to get to know your spine and treat you on a fairly regular basis. And we're going to prevent a lot of those things going forward. There's a lot of research that shows that regular chiropractic adjustments, it intends to be in 4-week increments, will reduce days of disability per year by 28 days. And so ultimately you get in that chiropractic mindset, that chiropractic model, and we're going to keep that spine healthier much longer, keep it functioning, prevent those blowouts. When we do have that blowout, it ends up being a shorter duration and a shorter or less intense episode. So that's where we try to attack it.